Are you suffering with pain on the outside of your wrist right here? Then you could have something called TFCC, or triangular fibrocartilage complex irritation. You can tear this group of fibrocartilage right here. So we're going to say, for our purposes of the video, this is going to be non-operative care. Your physician has MRI'd this area or maybe made the decision, doesn't feel like that it's unstable and that it just needs some rehab and some strengthening and tissue loading. So this is going to be 4 techniques. Now, as always, you can use heat or ice, whichever you feel works the best or you like the best. I don't necessarily have a preference, so you can use that to try to minimize some of the pain and all that you're having. The first thing we're going to do is grip strengthening. So you can get this pretty inexpensive. If you go to my website, chadgeorthot.com, under my Amazon favorites, I'm going to have a link to one of these, the one that I like. And this is adjustable, and so you can just adjust the resistance so that you can just sit there and work on grip strengthening. And I would complete somewhere between maybe 2 to 3 sets of 10 to 15 repetitions. If you can complete 20, 30 repetitions, you need to adjust the resistance so that you're kind of getting difficult at around that 10 repetition mark, and by the time that you get to 12 or 15 repetitions, you're really getting some fatigue in the muscles. The next thing we're going to do is take a dumbbell. This does not have to be a dumbbell. In fact, initially I encourage you to use a pretty light dumbbell. This one is 2 pounds, and I'm just going to prop my forearm up here so that my wrist hangs over. Now you can use a towel roll at home or just anything to give you a little support here. My elbow is down here on the table, and I'm just going to go into wrist flexion just like this. Now my wrist always pops. I don't know if you guys can hear that popping. Now here's the thing with this. I used to do this. I go straight, try to go in that pure kind of plane of motion here. Now I do more of like a wrist flexion with an ulnar deviation, and that just feels more natural to me. Now, if you do this and you get too much of a pinch and that's too uncomfortable, just don't come up as far. Just kind of come up and then come back down and then come up and come back down. And I would complete with this somewhere between 2 to 3 sets of 10 to 15 repetitions. So we're going to take this same dumbbell here. I'm going to kind of grab it at the bottom. Now, initially, I would probably grab it maybe even in the center and just work on, I've got my forearm propped up here, and just work on supination and pronation. So palm side up, palm side down, and I would do 2 to 3 sets of this for 10 to 15 repetitions. As that becomes easier, you can grab the dumbbell closer to the bottom. That's going to be a little harder. So I advise you initially to not do that and grab the bottom, because that can be really uncomfortable. It may over irritate the area here on your wrist. The last thing we're going to do is going to take the same dumbbell. Probably, at some point you're going to have a heavier dumbbell. And I'm just going to work on holding it up just like this. Now I can go all the way overhead, or I can just keep it right here. Initially I have patients just kind of support the elbow on the table and really focus on just keeping this nice straight in a line. And then I would work on holding it like this, and then I would go overhead, just statically holding that. And how long do I hold it? Somewhere between maybe 30 seconds working up towards a minute, and then I would change the position. And once I got to where I could hold it overhead pretty confident, didn't really increase my pain too terribly much, then I would increase the dumbbell, the weight that I'm using. It's okay and normal for when you have ligament issues or tendon issues to have some pain and discomfort while you're performing the movements. Of course, you want to make sure that your doctor is okay with everything that you do and anything that's in these videos. But provided that that's okay, you want to make sure that you're going to have some pain. Just make sure that you're still kind of keeping everything nice, strict, and stable until you get to the point on down the road several weeks later where you're getting back in the gym or working out with heavier weights or going back to your job, duties or whatever that is. So again, those are 4 tips that you can do to try to increase your strength and try to decrease your pain with TFCC. Thanks for watching.